Now I recognize Dr. Bucshon for 5 minutes of questions.
Thank you, and thank you, Director Cohen, for being here today, and thanks for recently coming to the GOP Doctors Caucus. I very much appreciate it. Your job isn't an easy one. You knew that coming here, though, right? Yet you've taken on the challenge, and I have a great deal of respect for that. I want to quickly follow up on what Mr. Peters said about data. The key is making it clear to the American people this is de-identified, non-person specific data. That's the challenge I have in rural America. People just don't trust the feds on this, and we have to make sure that we do that. And I agree that we need better data. As I've discussed with your predecessor, Dr. Walensky, as a physician myself, political influence must be removed from the decision-making at the CDC, and I've mentioned that to you at Doc Caucus. This has happened recently under both Republican and Democrat administrations. We're all aware that a substantial percentage of the public has lost trust in the CDC, and we can agree or disagree on how exactly that happened or what the implications may be, but I believe all of us looking forward can agree that something needs to change if the agency is going to be effective at combating the spread of communicable diseases, as was its original mission. Let me remind everyone the CDC was established in 1946 as the Communicable Disease Center, the CDC. It was born out of the goal of preventing malaria and typhus in southeastern states. The CDC has been the preeminent organization in the world on these issues for decades, and still is, in my view, even with the challenges created by what I consider overbearing political influence. With that statement, I want to talk about specific communication and how we communicate and convince the American people that we're making progress here. On the communication side, do you have specific actions you've taken or do you plan to take to get to the American people what the CDC is doing and why?
Well, thank you, Dr. Bucshon, for that. And yes, I hope you are already seeing the CDC communicate differently. First, we've overhauled our website where people do come, and there's more to come with that as we continue to consolidate the information so it's more usable, people can access it more quickly. But we're also communicating in different mechanisms. So, for example, when there was a new variant that we saw in August, we immediately put something out to say, here's what we're seeing, here's what we know, and here's what we don't know. I think that was brought up earlier. So we're trying to rapidly communicate, and we're trying to use different mechanisms to communicate. So we're trying to make sure that we are meeting folks where they're getting their information. They're not coming to our website necessarily for information. We have to go to where folks are, whether that's using social media or others. So you're seeing me post a lot more videos. So we recognize that some folks want to watch a short video to understand a complex topic. So I think there's a lot of ways in which we're changing up how we're communicating. But we're still going to make sure that we are focused on bringing the best evidence and data to that, but make sure that it's simple and timely, as well as work on the ground for real people.
Yeah, because as you know, as political people like ourselves, communications is key, and that has changed dramatically over the last 10 years, right? And if we're behind at an agency, you just don't reach most of the people. You have to be on social media. You have to do, to your point, go to where you can reach people. I have adult children. None of them watch the regular news. None of them. They get alerts on their phone, whether that's on Snapchat, whether that's on Instagram, X, all of those, and I'm hopeful that we can do that. Who do you seek guidance on to help you do this? I mean, who's helping? Is it, I mean, I would argue that maybe it should be Madison Avenue.
Well, first, you can already follow me on Insta, but we have brought in, additional folks to make sure that we're modernizing how we're thinking about communication, and so I think we still have work to do, but yes, important.
Do you have an internal? Does the CDC have a robust internal communications and public relations department specifically to address this?
Yes, sir. We have a communications department. It's under new leadership. I think they're doing good work, but we're not all the way there. We have more work to do.
Okay, I appreciate that. And you're aware of the CSIS report on Modernizing?
Oh, yeah. The CSIS, yes, sir.
This report?
Yes, sir.
Yeah. There's a lot of good things in there. It was a bipartisan commission. I know that that Dr. Walensky and I talked about that. We actually had a meeting over at CSIS here in town. Dr. Walensky was there. There's a lot of good ideas in there, bipartisan. I just encourage you to use this as a resource along with your internal moving forward program.
Yes,
Thank
sir.
you.
Thank you.
Now I recognize Representative